Hi, Dr. Minkoff, LifeWorks Wellness Center. Today I want to talk about shingles. Now, shingles is a devastating problem that some people get. Shingles is caused by the same virus that causes chickenpox. So the usual story is this: a person when they're 3, 4, 5, or 6 gets chickenpox, normal childhood disease. It goes away. Their immune system makes proteins so that if they're exposed again to chickenpox, they don't get it. But those immune proteins actually keep the chickenpox virus, which once you've been infected by it, actually stays in your body in kind of a dormant or sleep state. Okay? It tends to live in the nerve endings. As long as your immune system is good, the chickenpox stays asleep. But if in your life there's too many things going on, there's too many stressors, you get another infection, you over-exercise, your immune system may take a dip, or you're eating bad food, you're drinking too much. Things like this, which lower your immunity, then the proteins in your blood, which keep the chickenpox asleep and not active, go down. That means the chickenpox can wake up. And with shingles, what happens is it wakes up from where it's living, which is in a part of the nerves that are usually along the back. They're called the dorsal root ganglion. These are areas, they're like nerve hubs. And if the chickenpox wakes up in one of those nerves hubs, you're going to have an area of pain and usually red rash with little blisters on it, little clear blisters, and it hurts. And that is what we call shingles. Now, sometimes it can be in the pelvic area, sometimes it can be up in this area, sometimes it can be in the face, sometimes it can even involve the eye. So when this flares, we know for sure that there is some sort of immune suppressor. There is something that's weighing down your immune system. When we see somebody with acute shingles, we try to actually find out what is that thing so that we can do something about it. The virus itself is active at that time. And if you take little scrapings of the little blisters, you can get active virus. We have many different kinds of nutritional treatments that can actually attack that virus and kill it and get it to slow down and heal. Some of these are given intravenously, such things as ozone or hydrogen peroxide or IV vitamin C at high dose. Also, there are some herbal remedies that we can give that also help with getting that chickenpox virus to go back to sleep or get killed. So that in a nutshell is shingles. That's why you get it. That's what we do about it. The earlier that you come in, the better, because once it gets going, it's going to take longer. If we can get it right away, it goes away much faster. There are pharmaceutical drugs they're antiviral drugs for chickenpox. Sometimes these are prescribed. Again, if they're given very early, they can be helpful, but once you've had it 3 or 4 days, they probably aren't going to make any difference. Occasionally, what you see is someone with pain, but no rash. That can occur, and it should be thought of, because sometimes people have a chronic thing, they can't find it, the doctor feels it, they don't know it's there. We test them for chickenpox and we see, oh yes, it's active, and that shingles, or what we call herpes zoster, is present. Okay, so now you understand everything you need to know about shingles. I hope this helps.